on here because I just did a reset. So hopefully this time as we try to get people, hopefully as everyone's coming back, hopefully this time from the first reset that we did. Um Again, the rules apply the exact same as it always does on here. So just to list a few of those on here for those of you that are new, that are about to start coming in at any moment. Um, just know a couple rules on here are no disrespect talking whatsoever, so don't try to say anything towards me or my mods or even anyone else in the chat that's disrespectful because you never know if someone's went through something or is going through something that is not probably making them feel any better or just any of some sort. And y'all, I don't like to deal with drama, so let's just not do that whatsoever. Um, Number two, um, be sure to just be careful when you just be careful when you ask certain questions. I'm not saying you're bad at questioning me or anything, or anyone else in the chat. It's just safety purposes because, you know, some of us either don't, some of us don't either feel comfortable like sharing certain things that you're asking or we just find them not appropriate. Like, let's say you're asking something that's kind of dumb that shouldn't be asked on here where there's hundreds of people that need to not know it. Don't ask it. Don't even say it on the live, y'all, because it does not make sense to do something like that whatsoever. Um, so, um, yeah. But anyway, and also, y'all, another rule on here is just to have fun. Y'all, y'all, I do these live streams so we can all let loose for like 5 minutes to at least an hour or two. Like, we try to let loose because, y'all, as adults, y'all, for those of you who are, like, because I let teens come in here too, like normal. I don't really have, like, restrictions with people coming in here. But, y'all, as adults, we can't we can't always afford people getting up our nerves every day with just chaos and some of them just acting like a jerk or acting like a fool of themselves. You know? No. Yeah, because as adults, we honestly will think about it and we'll just see it. Oh, sorry, my dog's barking like she's a turd. Um, we'll just see it as a big waste of time of our day because someone could have literally asked or done something that was more appropriate than what they just did, you know? So we don't want to be in that. I don't want to be in that situation, or even anyone else on here wants to be in that spot. Because I mean, all of us adults don't want to be in that spot right now. Because some of us are going through stuff right now, or some of us are trying to get over stuff. Like I'm trying to get over a migraine, y'all. I will say that right now because I've had at least 4 days of migraine. Like I've had a migraine for at least 4-ish days or so. Um, but I mean, mine's not been super bad. But I mean, it's kind of getting back to kind of bad. But that's because I've been actively working too. So, even that's one of the things you do. But yeah, but I mean, thankfully I get to sleep in tonight, so I don't have to worry about waking up early tomorrow. So that's nice. You know, it's nice to know you get to sleep on other days that you don't have to be up early for anything like work or church or anything. Oh, sorry, my dog. Sorry, my dog is being an absolute turd again, so just don't mind her barking. In the background, she's outside, like, I can hear from this room, y'all. Which one of my parents, I bet, is about to swing that door open to grab her. us who have dogs all get the point of how they can act. You know, like we all know how they can be. Yep, like that. Swing it open. But anyway, if anyone's new here, welcome. And if you are a returning subscriber who's been here before on my lives, and if you're a mod on my lives too, welcome back. See, too much to go get her. But yeah, welcome back, you guys. We're just hanging out right now, so feel free to stop by, ask questions. You know, get to know each other on here. Also, feel free to hit the like button to help the YouTube algorithm grow, and also be sure to hit the subscribe button if you haven't done that, and the notification bell as well. So, like, set it to all notifications so you guys can get every update from when I go live to when I post on here, so that way y'all know, because this way everybody can get first first, like y'all are like the first people that get all things content. Nobody outside this channel will, unless if they subscribe. And that's the only way y'all will see content from me, is if you are subscribed to the channel. But if you aren't, I would recommend, and let's say you want to see more from me, I recommend subscribing so that way you can see and get all of those updates. Because, I would hate for someone to be left out and not be getting those updates, I just don't want somebody in that situation that could potentially. Sorry, my dog's being a turd. Because I can hear it from here. Anyway. Yep, I can still hear her barking. Wow. I'm surprised. I thought she came in. But anyway. She's such a turd. But anyway. Yeah. So. But anyway. Hopefully everyone's day was good today, though. To kind of give you guys an update, my day was alright. It was good. I had church this morning. And I actually worked with the kids today. For service, so I wasn't in service at church, but I was there for Bible study for like the first 45 minutes. So from 9:45 all the way through 9:45. But normally on a normal church day where I'm not scheduled on this schedule over there with kids and all that, um, when I'm not usually scheduled off the bat, um, usually I'll be in Bible study from like 9 a.m. till about 10 a.m. And then I would be in service from about 10 a.m. through either 11:10, either anywhere between 11:10. I don't know. I think it's anywhere between 11:15 11:20 a.m. So anywhere between that window. A lot, because y'all, our pastor gets decently caught up. And I mean, a lot of us can get how our pastors get. It's not a bad thing. It's good that our pastors get caught up in the message, because they should. Because if they aren't getting caught up, that just means they hate their job, and that's not really cool. So if you are getting somewhat caught up, do it. And if you're not, step up your game. Or else people are not gonna start coming to the church and go, "Oh, the pastor does not step up their A game." But if you're a pastor out there who steps up your game, good job. Keep it going, because that's what we all want to have happen. Like, my pastor does pretty good about stepping up his A game, because, I mean, that's good. You want a pastor that does it, and not just someone who just tries to even attempt doing it. But yeah, and so I had kids today, though, which went really well. And for those of you who have not For those of you who do not even know me, with that, I work in the kids ministry at my church now. So I finally have started back up after about 2 years because, as some of you do know, um, I did move about almost 2 years ago. Actually, no, 2 years ago, not almost 2 years ago. Around 2 years ago. Um, and I was only actually a senior in high school. So I was in the second semester of my senior year when I moved. And so, um, yeah. So that senior year it was between a good year and kind of a chaotic year itself because with me and moving to a whole different school halfway into the year, which was like halfway into my second semester, and just knowing that I was gonna graduate at the high school I visioned and hoped would have happened. I did not ever suspicion that senior year would change my life a little bit in the most chaotic way that you can think of and anyone else can think of. But um yeah. So anyway, yeah, but at the end of the day it was worth it because I got my high school diploma on May 17th and it felt amazing. Like it truly did feel amazing to actually have that happen. And so, um, yeah. Anyway, um, man, crazy words right now. But anyway, um, what else do I know? But yeah, all I've just done today though is I went to church this morning at Bible study, did the kids. And then after that, I came home, ate um like a late lunch, um, and then just relax because y'all, that's one of the things. Y'all, that's one of the things I like to do, especially when I am. But that's one of the things I like to basically do when I get done with churches. I like to come home and relax because, church is good, but also Sundays are a day to chill and just recover and just recover before the new week starts. And, and then you're going to go back at it. And so, um, yeah. Anyway, um, yeah. But anyway, um, yeah. So, anyway, um, yeah, it's pretty crazy. But, um, yeah, it's pretty crazy. But, yeah. So, anywho, um, yeah. See, I'm yawning at the craziest time of day. But we're gonna ignore that for like just a minute. Um, but, um, yeah, it's crazy. So, alright, and I see someone is slowly making it into here. But yeah, we're all just chilling out right now, though, y'all. So feel free to ask anything down below. Hopefully, everyone's day is going well, and hopefully, everyone is staying safe out there. Cause y'all, it's crazy out here these days. Just because there's people not doing what they're supposed to, making bad decisions. I'm not saying everyone is, but there's just people out there that are doing that right now, and just they don't know what they're doing. They're not following the law like they're supposed to. But also, just be safe in general because you never know what can happen at any moment of any day. So, um, and also be sure to hit the like button if you haven't. I know some people haven't started that yet because we really have had anyone came in here yet, um, fully, but, um, yeah. So, um, hang on. But yeah, so, um, yeah, that's just what's going on. But yeah, anyway, that's what's going on right now. So, um, yeah, we all can ask me questions down below. It can be anything. There goes, I had to point out just because it was at the wrong angle. But yeah, you guys can down below ask me anything down below. Just like I said, all I say about questions in general on my rules is to not ask anything that's not age appropriate. Also don't ask me questions that might make me feel that might not make me feel that might make me feel uncomfortable or anyone else in the chat feel uncomfortable. Not just It's not just me for questions here too. It can be anyone in the chat because there could be times where there could be more than one of us on here right now. Like there could be any possibility of that happening. Um, but yeah. Anyway, um, yeah. So anyway, um, yeah, that's just what's going on right now. And y'all, it's only 6:58 for where I live over here at the very moment. So, hang on, I'll be right back. So give me just a minute. Take it for a second. But yeah, you guys feel free to hit the like button on here. Because, it's very important to, um, just do what you can do in here. But, okay, sorry about that, y'all. Um, yeah, so. I need to put this laundry up too. But I'll do it in a minute. But anyway, um, just to kind of give you guys a little bit, and also mind the room being a little bit dim, like a lot dimmer than you would see it. Like I said, I've been dealing with this migraine for like 4-ish days, so that's why it's been a little bit. That's why it's been a smidge darker. Like, I mean, if I'm over here, you'll see me, but if I'm way over here, you'll be looking at me a little bit more confused than. But wait, actually, I can stand myself right there so you can still see what's going on. But um, yeah. But for those of you who are kind of wanting a fit check of the day or so, I will give that to you guys. I'm gonna just stand right here because this is kind of where a lot of you guys will see. Okay, so fit check of the days for those of you that are kind of wondering where stuff is from. Um, this plaid top I've worn since like this morning. Since I've gotten ready for church. Is from Christmas I got. Um, and then these sweatpants are from Walmart, but the brand on these are, but the brand of sweatpants are called Athletic Works, so they're really good sweatpants, y'all. Um, I think the brand on the I think the brand of plaid I'm wearing, it has to do something with farm, I think. I need to look at the tag again just to check, but I think it has to do with something with, like, something. Like I said, I totally forgot because, you know, a lot of us can barely remember a whole lot here, and so, um, hang on. But anyway, um, okay. Sorry, guys. I was putting the question bar down below, so that way, people could get an idea of what we're doing right now that do decide to join. I don't know why we're getting barely that many people on here, but I even reset my life like not that long ago. So, yeah, then also I'm wearing these hoops that are from these small black, like medium black hoops from Time True. Glasses are from Sam's Club, y'all. These things are like, oh, what would I say, 2.5 or so, or 3 years old? So they're old. Like, y'all, I don't know if like, you can even tell. Like, unless if I like Ellie like this, you can see like if I like at the line like this, like the lenses are starting to wear off because they're old. I've had these things for about for like at least 2.5 to 3 years at this point, and glasses do not last. Like they don't last you eternally. They do get old over time. So eventually, soon, hopefully this week, if my parents, like if we're not really busy with anything or so, once my mom can look at our insurance to see what places in our area will take our insurance, because the thing is, when you also go shopping for glasses, you want to make sure you go somewhere where it takes your insurance, then go somewhere randomly and go, oh, assume that they take your insurance when you don't know if they do or not. Um, but yeah, so hopefully sometime this week, possibly if it doesn't get too busy. Um, hopefully, I'll go in. Um, hopefully me and my mom can hopefully go by somewhere and take a look at frames just to get an idea. Just to look at some new ones because, like I said, these are getting old. Like I've had these for about 2.5, almost 3 years now. And I usually have so far I've seen my eye doctor about every 2 years so far. Every 2.5 years or so. Just kind of crazy. So it's like, you gotta do what you gotta do at the end of the day. Because, and plus, your eye health is also important if you are like me, who has really bad eyesight, but also has like a little bit of a medical condition with the eyes too. Because some of you know this, but not all you do. But if some of you are new here and don't know this about me, I have what's called lazy eye. And if anyone's never heard of the term lazy eye, or if you have, or you just really forgot it, that's just where one of your eyes just looks. That just means one of your eyes just doesn't align with the other. Because for reference, the way your eyes are supposed to be aligned or like the same is like straight. Like they're supposed to be looking straight ahead and not left or right. And so for me, my right eye looks this way. So if I were to point in directions with my hands here, my right eye looks like this. It will look like you can see how it's looking that way. Can't see because all the glare keeps coming in the dang way. But you see how my right eye just looks like it looks this way and not this way, not at the camera. Unlike this one, it does. That's basically what it just means is one of your eyes just looks the opposite direction when the reality is you're looking straight yourself like you're not looking that direction, but you're looking like in front of you, but just the eye will make you think that you're not. It's kind of crazy. But I mean, y'all, there is different but there are like different like sorry, make sure that. But there are like different like things you can do for it. Just it varies depending on the level of damage that your eye is at that moment. Like if yours is like mine, where it's a little bit, where it's kind of, it's, ugh, I say it, where it's basically a bit far damaged to where you can't do what you think would, and the only option you have is to either do surgery on the eye or do nothing at all about it. Then that's the only thing you got. And it's not like it's required anything or anything that's like urgent. That's if you feel like if you want to. And so, um, yeah. So, um, yeah, but, um, but let's say if your lazy eye is not like mine. Like, let's say it's a lot more lower, and let's say you can do a lot more stuff. Like, you can do, some things you can do out there, for those of you who are looking for ideas, you can get, medical patches, so medical eye patches where you put the patch more on your weak eye. I think it's your weak eye or on your strong eye but what it does though is you put it on your eye and you wear it for like at least a few hours of the day. Like maybe 8, 7 hours a day. At least it's anywhere in that window. But you put that on for like a few hours a day and it basically helps to strengthen that eye slowly um slowly start realigning to the right shape into the right direction that's supposed to be looking and not looking like what you're looking at right now. So for example, if I did used to be in that case back in the day, but since now that's because I was like a kid, y'all, and kids take things off the bat. And I think I was like 3. I was at least 3 or 4. And I mean, y'all, a 3 or 4 year old can take things on and off like quick like this. They can just yank them off and all that, but not really keep things on like that. Um, and so, um, yeah. So, um, for me, um, I'm getting itch on this side now. But yeah, so basically, with me though, I personally, but there are like different treatments you can do for it though too. Like another thing you can do is something I learned recently from my neurologist, which is funny because a lot of you do know this too that have been watching me for a little while to a year that I have epilepsy. And so I have to every year, um, one of my doctors I go and see every year for checkups on top of my primary care physician annually is I do go see a neurologist every year just to make sure I'm still doing good on medication because I do take medication for my seizure activity, so that way it doesn't try to come back at all, which I've been doing well. But of course, the thing is, with epilepsy, it's a thing where you would want to go to a neurologist at least every year or so, or at least every couple years, just to make sure that A, you're doing well on your medications and making sure that you're still doing good and not declining really quickly because you could be having a bunch of seizures and just trying to, and even that's also where you try to figure out, like, let's say if you're someone who keeps having seizures constantly, even doing treatment, that's when they really can figure out the right treatment plan and all that for you. So that way you don't have to go crazy to yourself. Like y'all, like I said, another thing about me too is my seizure activity was a lot more chaotic when I was a kid. But that's more because when we're kids, our brain grows and develops at each age and each day of our childhood. So the way that my brain would just develop as I would age and grow, the way it will react with me, it just wouldn't. It would cause me to have a bunch of seizures a lot. And so um like there's been a couple times where I've had to been hospitalized for my seizure activity because either I would have um maybe more than one seizure within a certain hour time period, uh or my rescue meds, I also have rescue medication. So if I were to have that way, if I had a seizure in public or something that lasted within a certain time span, then I can have that administered quickly, and a likely chance it can snap out like within like ASAP without having to possibly go into the ER, you know? But unless if it wants to not work, then, different story short. And so, yes, that's the only time too that I would have to go to the ER is if my seizure is longer than 5 minutes, or if I have more than one seizure, or if my rescue medication or just meds I use for seizures stop working completely. Like either they stop working or they are trying to work but they are not hitting me like they would. And so it's one of those things that you do have to really see if is and even that's a checkpoint too, is seeing if if your rescue meds are working like they should, or if your regular medications are either working or they stopped working because of your growth, or something might have happened with them that might have caused you to go into a seizure within an unexpected time period, you know? Um, but yeah, like I said, when I was a kid, I would get them more frequently. Oh my gosh, my brother. Hang on. Okay, sorry about that. My brother was being so noisy in the background. Anyway, like I was saying, it's just one of those things where you have to be sure you are doing those checkpoints too, because what if any of those things could be either be expiring on you, or they could stop working because of growth development. Because like I said, as kids, we grow a lot, and the way medication can act with your brain and yourself, and even with your body and its system reacting to the medications as you get older, all the time aren't gonna work properly. So a lot of times you're gonna have to either up your medication or go down just depending if it's when it goes up, it works, or if it goes down, it works. It just depends on what what you and your neurologist come up with. I'm not saying advice there, but everyone's medication that are that are epileptics out there, they all work super differently for anyone with it. Um, but yeah, and so even I would have rescue medication. So like in that case, if I had a seizure in public as well, not just at home too, then I can. But also I could have it on me at all times too. But also, let's say if I was at work in the future and I were to have a seizure, I can always have it with me. So if a coworker has to administer it, then you can, because that would be the next worst nightmare. I feel like for me, if I were to have a job and I end up having a seizure at work, like on the job during a shift, and you know my coworker's not knowing how to work my stuff without knowing it and all that, and just watching and sometimes what coworkers also don't realize is sometimes they don't realize that there is a certain window to watch to see that that rescue med is required to be needed. But if it's not needing to really be administered right away, don't do it unless if on the instructions it tells you to, because like I said, you don't want to go, so and so is having a seizure right now. Let me grab their medication that they showed me how to work. No, no, you do not do that first. First of all, you do the same old procedure you would do if any seizure case was going on. Then you time it, see how long it's going on for. Let's say if I don't come out of it within like a 5-minute window or longer, that's when you kind of know to have it on standby. So if you have to urgently use it in an urgent matter, then yes, use it. But don't go, oh, let me grab the thing and use it quickly. It's not like if you were to have like an asthma attack, you would use your inhaler right away. It's not like that where it's like, oh shoot, grab my inhaler before my lungs collapse. Because with an inhaler, that's something you can use kind of more frequently and more like quick than a diet stat, or because that's what I use, you guys, is what they would call a diet stat. But also I do use nasal spray too, because I've actually now learned that there's also a spray, which and the differences between the two are a diet stat is it's like a syringe that goes let's it's basically a syringe that you put like the medication stuff into, that you put in it. So let's say in my case, if a seizure were happening and if it was required to be used, you can use it within the instruction. But I did learn recently that there is a such thing as a nasal. I had no idea there even was a nasal spray out there. Like I had no idea about that until I think it was either my neurologist said that, or my high school nurse said that. And I'm like, what? But I think it might have been my neurologist, I think, that said that. Because when I did hear that, I'm like, what? Y'all, that actually kind of did make me feel a lot more relieved because, if you think about it this way, the way that would only work is using it in your nose and not in your butt, aka your bottom. So down there. And also that'd be good too because I don't have to, let's just say I don't have to worry about possibility of stripping my pants down there every time that it has to happen, because that's how it all would work, is you would have to take down there everything that you're wearing down there in order for it to work. It kind of does feel kind of silly though and weird and all that, because you're in public sometimes when it happens and you have no idea that you're in a seizure kind of state. But thankfully, with the nasal spray, you don't have to worry about um thankfully with that you don't really have to worry about like taking down any parts of clothing down there that you would think. And thankfully with nasal spray you don't really have to take anything, not even anywhere up here off at all. It's the same way like if you were using nasal spray for like allergies, because it does the same work as that. So that's like the best part. Um, but yeah, so and also it does have like the same instruction amount too. So um yeah, I'm tired. But anyway, um so I'm tired. Anyway, um yeah. So um I'm trying to fall asleep. Nice. Yeah. But yeah, so it's just one of those things where you really do have to kind of pay really close attention to make sure that you don't have to use it, or if you have to, you know what to do on it. But and even you can also, even a lot of people can even ask like medical professionals how to use stuff like that, because let's say if they're new to um a bunch of like stuff like that and they don't know what appropriate time to use it or how to use it in the first place if needed. You can always ask those people and go, "Hey, how do I use this medication because either a coworker of mine or a friend of mine has seizures and I don't know how to do the steps on here. So can you help me explain it?" Because they've used stuff like that before for patients of their own that also get seizures from anything. Because seizures are also not caused by epilepsy; they're caused by all kinds of stuff out there, like people who have cerebral palsy, um, people who are dealing with alcohol. Don't want to deal with people with that. Or if, or anything out there that's, related to all kinds of stuff. You know, we don't want to have to ever be in a situation where you might have to use it. I swear, we keep getting one person in here that keeps leaving, so y'all, if anyone's coming in this chat, I know someone keeps coming back. It's like every couple minutes or so. We've had someone coming in here but not saying anything. And also, there's a rule too in here. If you are coming in here, please make sure you are saying something at least. Just so that way I know, okay, someone was here and I'm not getting ghosted in the chat. Just, because I don't want to be one of those people. Plus, I don't want to. Plus, I don't ever do that to anyone else's like live stream that I'm on. I always make sure I'm saying either hi or something, so that way they know. Okay, someone's in. They're live. you know. And even though, y'all, that needs to be everyone else's assignment too, just in general, like that's everyone's homework, is to, when you're on someone's live and you want to say something, say something. Just, don't just try to sit there and just watch it, because what if, let's say, what if they're also a talking stream too, like I am, where they're getting viewers to ask you stuff, and let's say they go, "Oh, look, someone joined the chat," because first off, I can't tell who's in here by the numbers. Like I go, "Oh, here's so and so's name in the chat," unless if you say something like, "Hey," or you know, or you ask about my day or anything. That's how I know when someone's in here, is if you say something like hi, or how are you doing? How's your day? How was your week? Anything within that. Um, but anyway, um, yeah. So, but that is just a little bit of just some educational I will give out. And that'd be good, because then if anyone on here knows anyone with a medical condition that requires an diet stat or nasal spray, you kind of get an idea of what you're doing. For some, because some of it I do remember how you kind of install them, but not every single thing. But that's just a good way to get to know some people. But anyway, um, but y'all, I'm gonna go and get off live for the day. Um, Plus I am getting really tired too, just from me working on my butt for like 2 hours today. But anyway, guys, I'm gonna relax for the rest of the day, but I will come back on here sometime on Tuesday next. So I will see everyone back at it on Tuesday.